I think my first memory is our open house, when we literally had just unpacked the boxes. I think my office was still empty.
So it was exciting to have people walk in for the first time and see a brand new location from our old office at Copperfield. So kind of made the dream real of bringing a comprehensive cancer center out to the community.
Patients were just so happy for us to be here. We felt like we knew where we were going to go, but we weren't really sure what that journey was going to look like.
Most of the patients were shocked that they did not have to travel to Chicago or Hyde Park to get therapy that they could receive here now. Some patients said it was a little more personal as we had smaller staff, and so you knew your nurses, you got to know them over the 3 or 4 months of treatment. So it really brought to life the vision that we had.
Our multidisciplinary teams, the clinical trials, the medical oncologists right upstairs, over and over and over again. Even to this day, people say, I am so grateful that you are here.
My health prior to my breast cancer diagnosis was, I thought, well. I was diagnosed in 2011, went to University of Chicago downtown for my surgery, and I opted to have my chemotherapy here in town because I did not want to make the trip back and forth to the city.
I started out with breast cancer, and I came back around, and I was good. I went back to work. I was working. I got up one morning. I went to go down the stairs. My leg gave out on me. I fell down. I busted my leg up. Once I busted my leg up, ended up going to the hospital, and they said I had cancer in the bone.
I had no symptoms for prostate cancer. My GP was able to, over a series of years, keep an eye on my PSA, and my PSA numbers kept on increasing to a point where they became necessary to have surgery. To travel here from Mokina to the University of Chicago, to do that 5 days a week for 8 weeks, would have taken up all my time. From Mokina, it took me about 15 minutes to get to the Silver Cross. I was treated as a VIP patient.
To be able to get in the car, to go up the road, it's so much better. And it's less stress on your mind. And it's easy for me to know that when I go to the Cancer Care Center, they take very excellent care of me. It's not far from me. And if I call them, they're always there.
I had to have 6 months of chemotherapy and followed by radiation. I immediately was in shock because me as a nurse were not always good outcomes with cancer. And I was very reassured that I could have my therapy here at Silver Cross with the same prognosis and outcomes, so I definitely chose to do that. I think it is extremely important that Will County has this opportunity to serve the community. It's grown leaps and bounds since I was a child, and I feel very positive for the community that it is an awesome choice.
I just want us to keep growing and keep pushing forward. We've grown leaps and bounds. We had just one floor on the second floor of the Cancer Center, and we've expanded into Pavilion B, taking over the part of the second floor, and doubled our space just because that's how much we need. We want to be able to offer the patients everything they need in one stop.
It's really important for the patients and their families to get the very best care when they don't know where else to turn.
It's harder to travel. Let's be honest, it's 2022. Cost has become an issue now as well. And to be able to give people 80 to 90% of what a university can offer 10 minutes from your house, is fantastic.